Okay, Mark, so you've been a role player and an associate clinical educator for a number of years.
Yes, over 10 years now, yeah.
Over 10 years.
Yeah.
Can you tell me the distinction between those two roles, if you like?
Okay, a role player is involved in clinical communication in that they role play opposite a medical student as a patient or colleague to improve their learning in terms of their technique of clinical communication. An associate clinical educator is trained in the body system examination, so they're a hands-on resource for the student to work on. Then the ACE feeds back how well they carried out that examination.
Okay, so you mentioned the term body systems. What does that mean?
The basic body systems in the medical world: cardiovascular, respiratory, gastrointestinal, neurological, and musculoskeletal.
And so you give feedback on what? Their technique? Or
technique, yes. Never pathology.
Right.
We never teach them why they're doing anything. That's up to an academic tutor to teach.
So there's an academic tutor there in the room usually with you?
Yes, there is. Academic tutors would teach the student how to do the body system examination for the first time, and then we're a resource then to practice on, but we're a living resource. We feed back how well they did that examination.
So on things like percussion, palpation...
Okay, so for example, with percussion, we would be able to feed back whether they've done it properly, whether they were in the wrong place, things like that.
Yeah.
So with everything they do, we can have an idea, because we know how it's done correctly.
And because obviously you're a communicator as well as an ACE,
indeed,
you can give feedback on their ability to communicate effectively and build rapport with you?
Absolutely, yes. Yes, we look out for all that as well.
So how would a typical session play out, very briefly?
Okay, so normally a body system is picked for the day, and we'll be working with 4 to 6 students under the guidance of an academic tutor.
Yeah.
There might be a demonstration of how the examination is carried out, either by video or live, and then the students would each work on us, and we would feedback how well they did it.
Oh, okay. And that would include their communication as well?
The communication, yeah, absolutely, yes. We can also build to a level whereby we can give a history.
Yeah.
And have a physical examination and perhaps a management plan afterwards. So a full simulation of dealing with a patient. And there are certain things that we can simulate, certain problems we can simulate.
And you work with students in an exam situation?
We do, yes, in the OSCEs, yeah.
Right.
And once again, we are there as a resource for the exam, but also the clinical assessor can talk to us afterwards about how we felt it went, because although they've observed how the examination taken place, they haven't felt it. So we may have some comments about things that were done well or indeed missed out.
So you're able to give structured feedback on both communication and the physical exam itself?
Indeed, yes.
Sounds like a good package.
It is. It is. It makes a difference. And whenever they ask students for feedback, the ACE role always scores highly. They value it. One of the things you know is because we're lay people, we're less scary to work with.
Yeah, that's a good point.
And they like that. And they are often surprised by the level of knowledge we have. Because you pick up stuff on the job. And also I think for an ACE to be effective, they need to do their own outside learning as well.
Yeah. I was going to say ongoing training.
Absolutely, ongoing training and a desire yourself to learn.
Yeah.
To learn surface anatomy, to learn the common things that occur commonly.
Yeah.
And to make sure that everything you're teaching is right. Because once the academic tutor has cleared the student to work with you, it's your job then to make sure that everything they're doing is carried out correctly.
Right.
Bearing in mind, we only know how it feels. We don't carry out these examinations on anybody.
No.
They're carried out on us. So we have to know how they feel when they're carried out correctly.
So better than a real patient.
Better than a real patient. A real patient isn't going to feed back to you afterwards.
No, absolutely
about anything,
not.
Are they? Really, they're going to take the exam and then leave the consulting suite.
Okay.
So it's effective lay teaching.
Okay. Well, thanks very much.
Thank you.